All right, moving on to more types of drugs, antifungals. These are still anti-infectives, but we're no longer talking about antibiotics. An antifungal, obviously, is a drug that eliminates funguses or fungal infections. These are commonly happen when a person is taking antibiotics for a bacterial infection. Remember, we talked about superinfections, where the bacteria start growing up. Well, when you take antibiotics long enough, you give the chance for the fungi, which are on us all the time, to start growing out of control. And it can be surface, it can be internal. Superficial fungal infections on the skin or mucous membranes. A common one is in the mouth. What do we call that? Thrush. Babies get that a lot. Diaper rash is a form of a fungal infection. Yeast infections, okay? These are all fungal infections that are either localized or systemic. If they're localized, they're relatively easy to treat with a topical infection or topical treatment. You can put cream on a baby's bottom or swish and swallow in your mouth. But you can get fungal infections systemic. I took care of a patient who had a fungal infection within the lungs. He actually had colonies of fungus or mold growing in his lungs, and he eventually died. That's a really hard illness to beat. Antifungals go into 4 categories. Polyenes. Amphotericin is the most powerful of them, and that's used IV. Amphotericin, the nickname amphoterrible, because it has so many side effects. It causes high fevers and shaking chills. Some nurses call it shake and bake. It's kind of crude, never in front of the patients, but if you ever hear a nurse call or say they're getting shake and bake, that's what they're talking about. Nystatin is commonly used like in mouth or on diaper rash. There's ketoconazole, mycoconazole, clotrimazole. These are all different drugs that take care of antifunguses. So, specific antifungals, polyenes. The nystatin is for topical infections. Candidiasis, yeast infections. It's not absorbed orally, so you can't drink it. It's swish and swallow or gargle if it's the throat that's involved, and that's how you would coat the mouth. It can be used topically, surface of the skin, or vaginally. Amphotericin is for systemic, body-wide infections. It's administered IV for potentially fatal fungal infections. And the gentleman that I took care of that had the fungus in the lungs, he was getting amphotericin, and it didn't help. It is strongly nephrotoxic, cardiotoxic, or heart. It causes hypertension. It causes great electrolyte imbalances. So you can be watching a lot of labs for this. Amphotericin, chills, fever, vomiting, and headache at the beginning of therapy. You give a test dose over 30 minutes to see if they're going to tolerate it, watching for side effects. You will treat for the side effects because generally if you need amphotericin, you need amphotericin. It's because there is nothing else that'll work. So you give Tylenol or acetaminophen for fever and chills. You'll give an antiemetic, nausea, or Zofran maybe for nausea, vomiting. Antihistamine to decrease allergic reactions. Benadryl. Benadryl is a very good antihistamine. So just think of, if a person is that sick, think of all the other things that we're doing to them to get them better. That's why they call it amphoterrible. It is a bad drug. Antivirals. Now, antivirals are very different than antibiotics. Antibiotics are easy to kill because they are a cell like anything else in our body. They have a similar cellular structure. Viruses are different because a virus goes into our cells and uses our cells against us. Viruses can cause mild to very serious and severe infections. Antiviral drugs are used to treat viruses. And antiviral drugs are different than antibiotics. They are not interchangeable. An antiviral usually just prevents or delays the spread of a viral infection. It inhibits the viral replication. Now, it doesn't kill the virus generally. It just prevents it from growing too fast and allows your body's natural immune system to jump in and take over the battle. Here are some viral infections that some that we don't see hardly at all, and some we still see. Smallpox, that's gone. Polio, much reduced, still present in Africa and Southeast Asia, and probably a little bit in the U.S. too, with the current ability to travel so easily. Things spread, but it's much more rare than it used to be. Chickenpox, mumps, rabies, influenza, hepatitis, herpes simplex, herpes zoster, cytomegalovirus, and human immunodeficiency virus, measles. So right now, going on out in this country, there are many people that are no longer immunizing their children. Maybe not many, but a growing number of people. And the measles epidemic out in different parts of the country is growing very rapidly. So as a nurse, we will need to teach our patients why it's important to immunize against everything possible, because it's so much easier to prevent than it is to treat. And some of these illnesses you can't cure. Some are harmless. Well, none of them are really harmless. Chickenpox is a common childhood illness, but if an adult gets it, it can be life-threatening. So prevention is so much easier than cure. Antiviral drugs have been used to prevent some viral diseases. Vaccines prevent the diseases. Other antivirals are used to minimize symptoms. You probably hear things like amantadine or rimantadine, ribavirin. These are all medications usually used against respiratory illnesses. So they only work if they're started very early. Generally, if the virus is going for 3 days, it's beyond the treatment stage. So it needs to be caught early. And Tamiflu is another one. That's a brand name. So that's antivirals. Remember, they don't generally kill. They just slow the growth. They're much like a bacteriostatic, except these are viruses. And looking at our pharmacological class here, we're looking at the different side effects, the contraindications, patient teaching, nursing considerations. And for sulfonamides, that's Bactrim. That's the drug I'm allergic to. So that is antivirals. So let's talk about pharmacological classifications. Sulfonamides, penicillins, cephalosporins, tetracyclines, macrolides, aminoglycosides, and fluoroquinolones. So you're going to need to know the contraindications and precautions, the side effects, teaching, nursing consideration, and labs, the important labs for all 7 of those classifications. I know, a lot of work, really important though, because you'll be giving almost all of those antibiotics at some point in your nursing career while you're a nursing student. And as instructors, we expect you to know this. Sulfonamides, they were one of the first groups of antibiotics. Sulfa drugs are another way of saying them. Sulfasalazine, sulfamethoxazole. Sulfonamides are bacteriostatic. They antagonize or inhibit the enzyme essential for bacterial growth. So remember, they prevent growth. Contraindications. So if somebody is allergic to sulfa, they can't get this antibiotic. If they're pregnant or lactating, if they have renal impairment, just those drugs are off. These are an old drug. They're among the first antibiotics ever used, and they probably were the cause of so many people surviving, like World War One, World War II certainly, and Korea and the Korean War, because these were available so easily. Some of the bacteria that work really good, though, E. coli or Escherichia coli. We just say E. coli. That's usually in the gut. E. coli is caused by raw beef and sometimes on produce. Chlamydia, Toxoplasmodia gondii. These are UTIs, upper respiratory infection, ear infections, pneumonia. So almost, a lot of different places. So if you have a UTI, might be giving a sulfonamide. They're also frequently combined with other medications to improve. What do we call that? Remember? Additive. If it's two antibiotics, but if it's antibiotic, say a diuretic, that would be synergistic. Two different things with different actions that result in better results. Severe renal or hepatic disease or hypersensitivity, you're just not going to use these drugs. Side effects. These can have some very bad side effects if you discover that you are allergic to them. Nausea, vomiting, and diarrhea happen with almost every antibiotic, and that is a common and expected side effect. Crystalluria, that's crystals in your urine, or toxic nephrosis, toxic kidney. Anemia, thrombocytopenia, remember thrombus, clotting, so this would be low platelet count. Stevens-Johnson syndrome again, photosensitivity. So again, more different specific sulfonamides. Sulfamethoxazole, it's combined with an analgesic anesthetic. This helps for urinary tract infections. Bactrim is another combination drug. Pediazole, this is commonly used for children for otitis media or middle ear infection. So nursing implications. If you're getting sulfonamides, you must drink at least 240 mils or about 2.5 liters of water a day, unless you have a reason you can't drink that much. Avoid sunlight and tanning beds, and these drugs also reduce the effectiveness of oral contraceptives. Something to think about. That's an important thing to consider. Those are all patient teaching things. Penicillins, another antibiotic. This was introduced in 1940. Remains a safe and very effective antibiotic. They're bactericidals. They kill a lot of gram-positive and some gram-negatives because they inhibit the bacterial cell wall synthesis. Remember, bactericidal, kill the bacteria. These were created from molds. Alexander Fleming found this on some oranges. So these are chemically related. Penicillins are all chemically related, and they are derived from mold. So they're used for mostly gram-positive infections, such as Enterococcus, Streptococcus, and Staphylococcus. They can be used for some gram-negatives, but those are the big ones. Again, nausea, vomiting, diarrhea. All of them. Abdominal pain, superinfections, colitis, or irritation of the colon. Allergic reactions are the common ones are itching and rash. Angioedema is common, 10% are fatal. So if a person is allergic to a psyllin, you'll never get another psyllin ever, because you never know if you're going to have sensitivity all across. Now, there are some bacteria that produce enzymes that destroy penicillins. Remember we talked to this? The beta-lactamase antibiotics. So if a beta lactamase bacteria. So if a bacteria creates beta lactamase, penicillins are ineffective. So there are some penicillins that are combined with and other chemicals that inhibit beta lactamase. So tazobactam, sulbactam, clavulanic acid. There we go. If you've ever had strep throat, sinus infection, ear infection, and were given augmentin, that's amoxicillin plus clavulanic acid as a combination. So some penicillins, combination drugs, there's combinations. Ampicillin sulbactam is called Unicin. Amoxicillin clavulanic, we just talked about that. Piperacillin tazobactam is a very common drug used at Holy Family called Zosyn. So there are natural penicillins and there are other penicillins. Natural penicillins are penicillin G and penicillin V potassium, or PenVK is how we say that. There are bacteria that create penicillinase, which is an enzyme that attacks penicillins, but we have some penicillins that are resistant to penicillinase. Medicine is constantly finding new ways of fighting new problems. Therapeutic uses, gram-positive, we already talked about, streptococcus, enterococcus, staphylococcus. So in other words, cocci are usually very susceptible to penicillin. Any of your patients who are taking penicillin, you need to monitor for 30 minutes after taking it. And that allergic reaction will not necessarily happen on the first dose. It could happen on second, third, or fourth dose. Your body develops a sensitivity, and all of a sudden, boom, now you have the reaction. And avoid taking caffeine, citrus fruit, cola beverages, fruit juices, or tomato juice with oral penicillin because it reduces the effectiveness. So your morning dose of penicillin, take it about an hour before anything for breakfast. Because if you notice, caffeine, citrus, cola, fruit juice, or tomato juice, that's breakfast, isn't it? Cephalosporins is a semi-synthetic derivative from a fungus. It's very similar to penicillins, but it's semi-synthetic. And these are bactericidal. They're broad spectrum. They kill many gram-positive and gram-negative bacteria. There are 4 generations, according to exactly how they have their antimicrobial bacteria. In each group is effective against a broader spectrum. So first generation, good gram-positive, poor gram-negative. These are the ones that are used for surgical prophylaxis. They're also used for upper respiratory infections and ear infections. Cephalexin or Keflex is very common. Cefazolin, or the brand name is Ancef. Those are very commonly used. Second generation, good gram-positive, better gram-negative, also prophylactically, and for abdominal or colorectal surgeries, because these can be very, very dirty surgeries. Cefaclor or C-chlor is common. Cefoxitin. Cefotetan I've given many times. Cefuroxime is very common. That's called Rocephin. Third generation. Now this is more effective against gram-negatives, but less activity on gram-positives. And it has some effectiveness against anaerobic bacteria, bacteria that grows without oxygen. I'm sorry, cefuroxime is not Rocephin. Ceftriaxone is Rocephin. Had a little brain cloud there for a second. You'll be in your clinical rotations, you will be giving a lot of cephalosporins. Some of the third generation ceftriaxone or Rocephin, it has a 1-a-day dose. So that makes for very simple dosing patterns. It's easy for people to remember 1 a day for IVIM. And it passes through the CNS into the brain. So if a person is having meningitis, Rocephin is one of the few things that can be used. And then there's 4th generation. These are the most active, most potent against gram-negative, and they have less activity against gram-positive. So remember, gram-positive, you're going to want 1st or 2nd generation. Gram-negative, you want 3rd or 4th. And if you have a meningitis or brain infection, Rocephin, ceftriaxone. Contraindications, well, if you're hypersensitive to any cephalosporins, you're not going to get any cephalosporins. If you're very sensitive to penicillins, because they are a semi-synthetic penicillin. If you have renal disease or if you're lactating. Side effects, nausea, vomiting, diarrhea, abdominal pain. Very dangerous ones though, pseudomembranous colitis, GI bleeding, could get seizures, could become nephrotoxic. So if you're allergic to penicillin, you have a 10% chance of being allergic to cephalosporins. Side effects, similar to penicillin. When you're giving a cephalosporin, you're going to watch for signs and symptoms of anaphylaxis and any other previous reactions. Orally administered forms should be given with food to decrease stomach upset, but this delays absorption. So this is the case where we're willing to have slower absorption to prevent additional GI upset. Because if a person, if they get sick every time they take a pill, are they really going to take it? Probably not. And if you're using cephalosporins and drink alcohol, sometimes you're going to get some really horrific results. Antabuse is a drug that's used to help people break alcohol addiction. When you take Antabuse, if you drink alcohol, you become violently ill. Not fatally ill, but I've talked to a person who uses this, and he says, you're not going to die, you just want to die. So cephalosporins can give you the same reaction. We're at 22 minutes. Come back for part 4, okay? Thanks.